Not so good. I need my pain medication.
Where's the pain hurting you?
All over, but it's really bad in my lower back.
Mm-hmm.
I need more medication than most people because I have a high drug tolerance.
Yeah, well, we just gave you your medication not even an hour ago, and, we can't give you any more medication for at least another 3 hours.
The nurses suck around here. I'm in a lot of pain, and I'm totally ignored because I don't have insurance.
Yeah, well, that's the rules. We can't give you the pain medication until after 4 hours pass, and you're just going to have to relax and bear with the pain, okay? I'll be back in your room to give your pain medication at noon, okay? Good morning, Karen. How are you feeling today?
Not so good. I need my pain medication.
Where are you feeling pain at?
All over, but it's really bad in my lower back. I need more pain medication than most people because I have a high drug tolerance.
Yeah, you told me that. On a scale of 1 to 10, how severe would you say your pain is? 10 being the worst.
About a 9 or a 10. I've had doctors and nurses I've told the doctors and nurses that I need higher doses of pain medication, especially now that they won't let me have morphine anymore.
You seem to be really frustrated with your care here, especially when it comes to your pain management. Would you be willing to share with me why your doctor isn't letting you have the morphine anymore?
Sure can. My doctor hasn't been here since they took me off the morphine yesterday, so I haven't been able to ask, but the night nurse told me that last night that I can't have morphine anymore because of my drug addiction, and that I'm what they call a drug seeker. When I asked her what that meant, she told me it means that I'm really not in that much pain, and I just want to get high.
Sounds like her telling you that really got you upset.
I could have choked her. How am I supposed to get better if the doctors and nurses here don't care about me and just ignore me because they think I'm a drug addict?
Yeah, I can see that you're very upset about this, and I understand how really frustrating this must be for you. You being in the hospital, and after all, this isn't the spot, the Four Seasons, is it? I understand how you could feel that the staff here is not meeting your expectations, but can I tell you what my take is on this?
Sure.
Okay. Our job here is to get you well, and I'm sorry that night nurse came in and was so abrasive with you. Do you think, though, that your drug and alcohol is an issue for your health?
Yeah, it is. I know I'm here because I drink too much and do drugs.
You seem very sad right now. Do you want to share with me why you're crying?
Because I have kids and I can't take care of them when I'm like this.
Yeah. What do you mean by like this?
When I'm high.
How often are you using?
Well, I drink every day and sometimes I smoke meth.
How often do you smoke meth?
About 2-3 times a week.
Has anyone talked to you about your usage and how it's affecting your kidneys and your liver?
Yeah, the doctor did, and this isn't my first time in a hospital. I know I shouldn't be drinking or doing drugs, and I'm not being a very good mother to my kids.
Yeah, you sound like you really love your kids, and I bet they really love you. And they really probably want you around while they're growing up, don't you think?
Yeah, I want to be there for them.
Yeah, I want you to be around too, and believe it or not, so does your doctor and even that mean nurse last night. And we all want you to get healthy. So while you think that the staff is neglecting you, we actually have your recovery first and foremost in our mind. Our goal, again, our goal is to get you well, and it doesn't stop there. We also want you to get the help that you need and that you deserve to break those addictions, okay? And those addictions are going to end up killing you. So can I give you some information about some of the ways that you can do that, break those addictions?
Sure.
Here's some information about some of the programs in the Las Vegas area, and such as Narcotics Anonymous and Alcoholics Anonymous, with a list of meeting times and also hotline numbers that you can call. Now let's talk about your pain, the pain that you're experiencing. Now I can't give you the medication until noon, right? But I do have some things that I can show you and teach you, alternative ways that you can reduce your pain. What do you think?
Sure, I guess. Okay,
great. I just have to check on another patient, and then I'll be right back with you, and then I can start showing you some of those ways to getting through the pain without the meds, okay?
Okay.
Okay, thanks. Take care. Therapeutic communication is the primary means through which nurse and client exchange information about health matters, plan treatment approaches, reach consensus about treatment decisions, and conduct treatment activities. Now, in the first scenario, the nurse ignored the opportunity to engage in therapeutic communication. He had the perfect opportunity to address the client's health issues and their relationship to her drug and alcohol abuse. There could have been several reasons why the nurse did not take the time to address the patient's addictions. The nurse may have had an intrapersonal conflict with the client's addiction and therefore found it difficult to show any empathy. Or perhaps he was overwhelmed with the number of clients that he had for that day. For whatever the reason was, the nurse did not encourage any communication for his client, especially any therapeutic communication, and he actually increased the client's anger, anxiety, and stress. The nurse's lack of compassion and lack of therapeutic communication was not at all conducive to a positive health outcome for his client. Now, in the second scenario, while the nurse was still adhering to medical protocol and that he did not give this client any more pain medication, he did take the time to address the pain medication issue and saw an opportunity to address her drug and alcohol addiction. The nurse recognized 3 issues and applied specific strategies. First, by talking with the client, the nurse discovered that the client had experienced conflict with the night nurse and knew that he must first diffuse the anger that the client was experiencing before any therapeutic communication could take place. The client was feeling defensive, insecure, and judged, and was dealing with an emotionally laden topic. And until the nurse could reduce those barriers, the patient would not be able to engage in any positive therapeutic communication. Secondly, the nurse began using active listening responses as he encouraged the client to share what was going on. Those listening responses included minimal clues such as smiling, nodding, and leaning forward during the conversation. The nurse also asked for clarification and used paraphrasing and reflection when discussing the client's feelings about the conflict with the night nurse and also the client's substance abuse issues. Through active listening, the nurse was able to show the client that he was fully present as a professional partner and was genuinely empathetic and interested in a positive health outcome for his patient. Finally, the nurse in the second scenario did a much better job in assessing the client's pain, in that he asked not only where she was feeling the pain, but also how intense the pain was. Also, knowing the client's history of drug and alcohol abuse, he saw the opportunity to teach his client alternative ways of relieving pain. And he was also able to provide information for getting help for her substance abuse problem, which was a major factor and underlying causation for her disease state. As nurses, we need to be aware that therapeutic communication is a critically important part of client assessment, diagnosis, planning, intervention, and positive health outcomes for our client.